Welcome to my presentation, everyone. My name is Sammy Davies, and I will spend the next 20 minutes with you discussing the comparison of relationship depth in remote and in-person therapy and the effect it has on a client during counselling during the different forms of therapy given. I will also be discussing how mindfulness impacts counsellors and whether or not counsellors who practice mindfulness experience more or fewer moments of relational depth. A little about me and why relational depth is so important to me. I've spent the last part of, say, the best of 20 years working in various roles within the public sector, namely probation, wellbeing officer in schools, and youth worker. I'm also an intuitive psychic medium and healer. I have my own business doing this. So witnessing how important working side by side with individuals and building relational depth has always been something that's been really important to me in all my roles that I facilitated throughout my life, especially working life. I wanted to understand and deepen that connection, which has led me to this course and led me to counselling and my future. COVID has also affected us and this connection with all public and mental health sectors. So this is also something that I wanted to look at within this study has given me that opportunity to see how it's affected that connection, that relational depth by looking at the different levels of how the therapy is given. Working remotely was a struggle for me as well, and it was something I wasn't comfortable with. So it was something I was interested to look at in more depth. What to expect from today's presentation? We will explore relational depth in terms of its definition and meaning, how it's experienced, and how the effect on therapy and therapeutic outcomes. We'll also look at the modes of therapy and how it's taking place in counselling via face-to-face or remotely, and how they impact on relational depth. Our research led us to want to know the unanswered questions around relational depth and the mode that therapy is undertaking now after the pandemic, and also query whether counsellors who practice mindfulness are more likely to experience moments of relational depth. I will give you an insight into the methods that we used, the results we found, and what those results mean for the future of counselling profession and the impact that it had on the theory and practice, with some ideas where the research could take us in the future. So what is relational depth? From research and practice, it's been coined as the most influential element of effective therapy. It's all about the quality of the relationship between the counsellor and the client, and we are talking about profound experiences of connection where both client and counsellor are authentic with each other and understand each other in a very profound level. Experts have stated and coined this as that space, that moment, where people really feel safe enough to be vulnerable and open up. Munz introduced this concept of relational depth into psychology for us, and he suggested that achieving this relational depth is necessity in the therapeutic conditions as outlined by Rogers. So these conditions are viewed as really essential and adequate for facilitating that change within the relationship. I'd just like to now introduce some mindfulness definitions to you. So by being mindfully present and attentive to the current moment without criticism, one can foster a deeper connection and intimacy with others, by Snyder et al. While many tools and techniques can be used to cultivate relational depth, one that stands out the most is mindfulness. Ryan et al. Found that mindfulness could potentially enhance the development of effective therapeutic connections. The study that he employed had the Working Alliance Inventory, which was invented by Houth and Greenberg in 1989, and it's the most commonly used measure to measure the therapeutic relationship to assess that connection between therapist and client. However, no research as yet until this point has investigated the effect of mindfulness on the frequency of moments of relational depth within the therapeutic relationship. Since we've been talking a bit about the background, I just wanted to move this presentation forward and ask what changed and what are the facts. So the COVID-19 pandemic brought changes to the counselling delivery and prompted exploration into experiencing relational depth in remote counselling versus in-person counselling. While online therapy faced criticism, the lockdown led counsellors switching to remote counselling, with some continuing to work remotely due to positive client outcomes. Research suggests benefits in remote therapy, including improved access to mental health services and has helped reduce depression and anxiety. Nonetheless, there still questions remain about the overall efficacy of remote therapy. I would just like to take this moment just to ask, what does relational depth mean for you in terms of your own therapeutic experiences of either giving counselling or having received it, being a client either remotely or face to face. What were the questions that posed for you? Were there any concerns? Was there anything that worried you, or did you really enjoy it, or did it not affect you? If you'd like to take a moment to leave some comments in the chat, I'd love to get back to you and know what your thoughts are. Continuing with thinking about COVID-19 and how it impacted us all and therapy, it leads me to ask the question, are we more or less connected now? There is a growing evidence of research that clients find it easier to establish a working alliance with a therapist in remote therapy, while therapists are more divided within their views, with concerns about feeling less engaged due to weaker sensory experiences and technical challenges. However, research also suggests that therapists can become more comfortable and confident through experience whilst forming these ties, and examine whether remote therapy affects relational depth and its frequency, and whether therapists need a little bit more of guidance in building these relationships. This leads me now to our aims and hypothesis. The purpose of the research, hoping to help counsellors understand what they might need to do to experience frequent relational depth with their clients. Our hypothesis, we had two, and the first was relational depth will be experienced more frequently within in-person short-term therapy than in remote. And the second hypothesis was relational depth will be experienced more frequently with the counsellors who practice mindfulness. I would like now to take a moment to explain the methods and the participants and the design. So the opportunity sampling was, we managed to get 88 participants, 38 clients and 50 counsellors. The clients were 35 female, 2 were male and 1 preferred not to say, and the age range between them was that of 20 to 62, with the average age being 40. For the counsellors, there was 48 females and 2 males, and between the ages of 22 and 65, with the average age being 42. The only inclusion requirement was that they had to be over 18 and that counsellors were practicing or currently in therapy, and clients had received therapy within the last 2 years or in current therapy, and that they were all living within the UK. We managed to get the population of participants from student population from Bangor and the general population through social media and the word of mouth. We had a dependent variable and 2 independent variables. The first independent variable was the practice of mindfulness, and we looked at that in a variation of high, medium or low in their practice. The second independent variable was the mode of therapy, so in person, remote or mixed, so a combination of both. And the dependent variable was the relational depth. The design that we used to look at this was an independent measures design, which had separate groups for both clients and counsellors for each level of the independent variable that they experienced. As we continue to look at the method, we now look at our measures. The first measure that we used, which was used with clients and counsellors, was the relational depth frequency scale. The questionnaire was used for clients and counsellors. It consisted of 5 questions with a scale running from not at all to most of the time, exploring statements such as we were deeply connected and I felt we were completely open with each other. Participants had to complete 6 sessions to take part in the research, and therapists were asked to talk about their most recent clients. And as you can see on the screen, here's a screenshot of the actual questions. There was 5 questions that took place within both questionnaires. Moving on to the methods, continued with the measures, the counsellor questionnaire only included a section of mindfulness experience, followed by the 5-facet mindfulness questionnaire, which you can see a screenshot of here on the screen. It used a Likert scale to measure mindfulness and includes 5 subscales. Additionally, the questionnaire assessed the level of mindfulness practice using questions on an ordinal scale. Counsellors answered 15 questions in total within this section to look at the relation of their mindfulness practice. Moving on to the results, and we conducted a one-way and over for clients. And here we can see the relational depth average graph for clients' results, which show the highest scores for relational depth. Interestingly enough, though, there is but a fraction between the average scores showing for clients that relational depth can be experienced in all modes of therapy. And the ANOVA results indicated no statistical significance difference between the groups of a p-value of 0.911, which is indicating that the therapy mode did not significantly affect relational depth. The therapist results, a two-way ANOVA showed a significant interaction between mindfulness and the mode of therapy. This indicated that practicing mindfulness at a high level was associated with the most frequent relational depth and in-person therapy, whilst practicing mindfulness at a medium level was associated with the highest level of relational depth in remote therapy. The results showed a significant main effect of mindfulness on relational depth with a p.05, indicating that mindfulness had a significant effect on relational depth. There was also a main effect of the mode of therapy on relational depth with a p-value of 0.1, suggesting that the mode of therapy had a significant effect on relational depth, and additionally there was a significant interaction effect between mindfulness and the mode of therapy on relational depth with a p-value of 0.5, indicating that effectiveness of mindfulness on relational depth varied depending on the level of mode of therapy. However, it did not account for the mode of therapy alone. So what does this mean for clients? Our results. The study examined whether there were differences in level of relational depth experienced by clients who received face-to-face, remote or mixed therapy. This finding then suggests that remote or mixed therapy options are equally effective as face-to-face therapy in developing a therapeutic relationship with relational depth. This is important because clients who prefer remote or mixed therapy options may feel achieve a higher therapeutic benefit. The study results contribute to the growing body of research on the effectiveness of different therapy modalities and support remote therapy options as viable alternatives to face-to-face therapy. Now moving on to what does this mean for our counsellors and what our results find. The counselling type did not impact the frequency of moments of relational depth. However, the counsellor's mindfulness practice significantly impacts the frequency of moments of relational depth. Both mindfulness and the mode of therapy significantly affected relational depth, and high mindfulness can lead to better therapeutic relationships, especially when participants receive face-to-face therapy, as backed up by research by Wernland et al. The study provided evidence that both mindfulness and the mode of therapy can influence the quality of the therapeutic relationship, and that high mindfulness and face-to-face therapy may be particularly effective in enhancing relational depth, which is also backed up by Keane 2014. So how then do we compare to the previous research? So like others, our study found no significant differences in the depth of the therapeutic relationship between face-to-face, remote or mixed therapies. However, compared to previous research, our study differed and found that a counsellor's mindfulness practice significantly affected the frequency of those moments of relational depth. High mindfulness can improve the therapeutic relationship, as Garrett and Caprose et al. 22. Explain, and especially in face-to-face therapy, which is what we found in our study. This means that remote or mixed therapy can just be as effective as traditional face-to-face therapy in developing a relationship marked by relational depth. These findings have significant impacts for mental health treatment, especially in the context of the COVID-19 pandemic, which has led to a surge in the demand for remote therapy services. So what were the potential practical and theoretical implications that led from our study? So the significance of counsellors' mindfulness practice in influencing the therapeutic relationship underscores the crucial role of mindfulness training for mental health practitioners. This finding suggests that mental health professionals who receive training in mindfulness may be better equipped to establish strong therapeutic relationships with their clients. This study finding that high mindfulness and face-to-face therapy may be particularly effective in enhancing the relational depth suggests that mental health professionals could consider incorporating mindfulness practices into their face-to-face therapy sessions. This could potentially improve the effectiveness of therapy for clients. It also suggests that mental health professionals who use remote or mixed therapy options could consider incorporating mindfulness into their practice. And overall, the study adds to the existing literature on therapy effectiveness, showing that remote or mixed therapy options can be effective alternatives to traditional face-to-face therapy. Additionally, the study highlights the significant impact of counsellors' mindfulness practices and the therapeutic relationship. Now to look at some future research suggestions. One aspect that could be considered for future research is the long-term impact of mindfulness training on mental health professionals. Our study focused mainly on the immediate impact of mindfulness on therapeutic relationships. It could be beneficial to investigate in the lasting effect of mindfulness training on mental health professionals in a clinical practice and their clients. Such research could provide insights into the potential benefits of ongoing mindfulness training for mental health professionals and its impact on the quality of the care that it can provide to them. Additionally, future research could also explore the potential moderating effects of various factors of the relationship between mindfulness and that therapeutic relationships. So, for instance, the research could investigate whether factors such as the therapist's experience, the client's diagnosis, or the duration of the therapy could all moderate the relationship between mindfulness and the relational depth. This research could help identify specific conditions under which mindfulness could best be effectively to work with, and could help in this research for this reason, to help such institutions as the NHS. Also, a cross-cultural study could explore the relationship between mindfulness and mental health outcomes in other countries. This could compare the mental health services and outcomes of societies that incorporate mindfulness already to those that don't. That study could then provide insights into the potential benefits of mindfulness for mental health and how cultural factors may also play a role. This leads me now to our final thought. The study suggests that high mindfulness and face-to-face therapy may be particularly effective in enhancing relational depth. These findings have important implications for mental health treatment, particularly in the context of COVID-19 pandemic, and it looks like remote therapy is here to stay. So this just leaves me to say thank you for your attention and interest today. Please do post your comments and questions below. We've got a window where we can respond to questions and I will respond. And I'll also put in the chat details of how you can access my handout for more information on this research. Thank you so much. Enjoy the rest of your day.